Today we're going to talk about 20 ways to lower your blood sugar. And these won't be the usual tips like drink cinnamon tea, brew bay leaves, or eat a spoonful of honey. Only methods that really work and that I regularly recommend to my patients. Some of them can improve your numbers within just a few hours. Others work more slowly, but they're the ones that help you keep your blood sugar under control for years. And what's really interesting is that most people with diabetes use only 2 or 3 methods from this list, even though there are many things you can start doing today. So let's not waste any time. Let's get started. And the first mistake is so common that even people who've been living with diabetes for many years still make it. Imagine a typical breakfast. A plate of pasta, a few slices of white bread, or a big bowl of instant oatmeal. No meat, no eggs, no cottage cheese, no vegetables. It might seem harmless, but in just 20 or 30 minutes, your blood sugar starts to rise pretty quickly. The reason is simple. Pure carbohydrates are digested and absorbed really quickly. It's a completely different story if you have protein and fiber alongside, like chicken, fish, eggs, cottage cheese, or vegetables. In that case, food leaves the stomach more slowly, carbohydrates enter the bloodstream gradually, and your blood sugar rises much more smoothly. So the simple rule is, if you're eating carbohydrates, you should almost always have protein and vegetables with them. And it really works. Since we're talking about carbohydrates, let's discuss another common mistake. A lot of people think that all grains are the same, but that's not true at all. There are products that cook in just 3 minutes, and then there are those that you have to cook for 20 or 30 minutes. And usually the second option is the better choice. Yes, it looks less appealing. Not as white, not as soft, but your blood sugar stays much more stable after eating it. You can swap out white rice for basmati or wild rice, and regular pasta for whole grain pasta. And as for sweet cereals, just leave those to kids and marketers. For yourself, it's better to choose coarse-cut oatmeal. Sometimes making this kind of swap can lower your blood sugar by several millimoles after a meal, and you don't even have to reduce your portion size. So what should you do if you're craving something sweet? Almost every person with diabetes wants something sweet from time to time, and that's completely normal. The problem starts when someone tries to find a healthier version of sugar. I hear this all the time. Doctor, I don't eat sugar at all. I ask, what about honey? Oh, I eat honey. Dates? Well, sometimes I eat those, and it ends up being a pretty funny situation. A person gives up a teaspoon of sugar, but can easily eat half a jar of honey. Your body doesn't care where the glucose comes from, sugar, honey, or Jerusalem artichoke syrup. It only sees the glucose itself. But fruits are a whole different story. Yeah, they have sugar too, but along with it, you get fiber. That's why an apple, a pear, or a small handful of berries will raise your blood sugar much more gently than a pastry or a piece of cake. There's another rule that seems way too simple, which is exactly why so many people ignore it. If there are no vegetables on your plate, then something's missing. Fiber acts like a kind of brake. It slows down the absorption of carbohydrates, helps you feel full longer, and reduces sharp spikes in blood sugar. You don't need to eat a lot of cabbage, and you don't have to buy exotic foods. Regular vegetables are enough. Tomatoes, cucumbers, peppers, cabbage, greens. Just a few servings of vegetables a day already make a big difference. But even healthy foods can be overeaten, especially things like nuts, fruits, grains, or whole grain bread. That's why there's a very handy rule for this. It's called the Harvard plate. Half of your plate should be vegetables, a quarter should be complex carbohydrates, and the remaining quarter should be protein foods. There's an even simpler way. Just use your own fist as a guide. So take 2 fists of vegetables, 1 fist of complex carbs, and 1 fist of protein. Why the fist specifically? Because my fist is one size, yours is another, and some 6-foot-tall neighbor might have a fist the size of a small frying pan. Everyone's needs are different. But even if you eat perfectly, your blood sugar can still stay high. And here's where a lot of people underestimate one thing: movement. Picture this situation. Someone has a big dinner, watches the news, settles onto the couch, and barely moves for the next 2 hours. That moment, your muscles hardly use any glucose, so your blood sugar stays high for much longer. Now let's look at another scenario. After dinner, you go out for a walk, even just 20 or 30 minutes. No running, no marathons, just a calm walk. And your muscles start actively pulling glucose out of your blood. Sometimes a simple walk after a meal works better than some supplements sold online for a lot of money. A lot of people think that diabetics absolutely need to go to the gym. But your body doesn't care if you're lifting weights or working in the garden. For your body, only one thing matters. Are your muscles working or not? Some people like swimming, some prefer cycling, others love to dance, and some just enjoy working in the garden. Any regular activity is better than not moving at all. Muscles are actually one of the main consumers of glucose. The more actively they work, the easier it is to control your blood sugar. There are people who are willing to spend hours discussing nutrition, buy glucometers, count bread units, but at the same time only sleep 4 or 5 hours a night, and then wonder, why is my blood sugar high again in the morning? Lack of sleep increases the level of stress hormones. The body starts to perceive the situation as a threat. The liver releases extra glucose, and the numbers get worse. Most adults need about 7 to 8 hours of sleep. Yeah, sometimes that's hard, but good sleep works better than many trendy supplements. There's another factor that many people underestimate. It's stress. When a person gets nervous, the body starts producing cortisol and adrenaline. They're needed for survival, so you can run away from danger or fight a mammoth. The only problem is that mammoths have long been gone, but loans, bosses, traffic jams, and the news are all still here. As a result, stress becomes chronic, and blood sugar gradually rises. That's why walks, favorite hobbies, spending time with loved ones, and even just regular deep breathing can be much more beneficial than they seem. The next method seems so obvious that many people simply stop paying attention to it. And that's a mistake. Drink enough water. When blood sugar gets high, the body tries to get rid of the excess glucose through the kidneys. Water leaves the body, along with the sugar. That's why people with diabetes often experience intense thirst. Some people start drinking sweet juices, sugar-free sodas, energy drinks, or liters of coffee. But the simplest drink is still plain water. It doesn't lower blood sugar by itself. It's important to understand this, but water helps the body avoid dehydration and supports normal kidney function. So unless your doctor has restricted your fluid intake for other reasons, try to drink water regularly throughout the day. Not just when you're already very thirsty, but a little bit ahead of time. The next mistake is very common. A person follows the diet for a few days, their blood sugar gets better, and then they start thinking, maybe I don't need the pills anymore. A week later, the numbers go up again, and you have to start all over again. Medications only work when you take them regularly, not just when you feel like it, not just when you remember, and not only when your blood sugar is high. This is especially true for medications your doctor has prescribed for ongoing use. So if you feel like your treatment has stopped working, don't stop taking your medication on your own. It's better to discuss it with your doctor. Sometimes it's enough just to adjust the dosage or change the treatment plan. There's another myth I hear almost every week. Doctor, just not insulin. For some reason, many people see it as a punishment, as if being prescribed insulin means things are really bad. In reality, that's not the case. Sometimes insulin is needed temporarily. For example, after surgery or during a severe infection, or when blood sugar is very high. Sometimes it really is necessary to take it long term, and there's nothing scary about that. It's much more dangerous to go for months with blood sugar at 15 or 18 millimoles per liter just because someone is afraid to start treatment. Modern insulin pens are easy to use, and the needles are so thin that many patients are surprised. The next method is to regularly check your blood sugar. Imagine you're driving a car at night without headlights. You probably won't get very far. It's the same with diabetes. If you never check your blood sugar, you simply don't know what's going on. Some patients are sure that everything is under control because they feel fine, but then they check their blood sugar for the first time in weeks and see 14 or 15. That's why a glucometer isn't there to scare you, but to help you understand which foods work for you, how walks affect you, what happens after exercise, and how your prescribed medications are working. It's all information, and information always helps you make the right decisions. Now, here's another topic that many people try to avoid. It's excess weight, especially when fat accumulates around the abdomen. This is what most often increases insulin resistance, meaning the cells respond worse to insulin. The pancreas is forced to work harder and harder, and blood sugar gradually starts to rise. The good news is that even a small amount of weight loss already brings benefits. You don't have to lose 20 kilograms. Sometimes it's enough to lose 5 or 7% of your body weight for your blood sugar levels to noticeably improve. The next method is to limit alcohol. I often hear the question, "Doctor, is it okay to have a little drink?" And here, the answer depends on the individual, their treatment, the condition of their liver, and other illnesses. But it's important to understand one thing. Alcohol can affect blood sugar levels in unpredictable ways. Sometimes it raises blood sugar at first. Other times it can actually cause a dangerous drop several hours later, especially if the person is taking blood sugar lowering medications or insulin. That's why, if you do drink alcohol, you need to do it extremely moderately, and always be aware of the possible consequences. Don't treat yourself based on advice from the internet. Every year new miracle cures pop up. Sometimes it's berries, sometimes seeds, sometimes exotic mushrooms, or yet another secret recipe. And the promise is always the same. Get rid of diabetes in 2 weeks. Unfortunately, diabetes doesn't go away because of a single product. If there really were a way to cure the disease with just a cup of tea, endocrinologists would have been out of work a long time ago. So approach such promises with a critical mindset. Double-check information and discuss any changes to your treatment with your doctor. Get regular checkups. A lot of people think that if their blood sugar improves, they can relax. But the tricky thing about diabetes is that complications can develop unnoticed for a long time. That's why it is so important to stay on top of regularly monitoring not just your glucose, but also your HbA1c, your kidneys, eyes, feet, and your overall blood pressure levels. These routine checkups help you identify potential health complications before any serious symptoms appear, which means you can take the necessary action well in advance. And the very last method is quite possibly the most crucial one of the group. Don't look for a single magic solution. There is no product, pill, or exercise that can solve the problem on its own. Diabetes always comes down to the little things, to what's on your plate. How much do you move? Are you taking your medication? Are you monitoring your blood sugar? It's these small daily habits that ultimately determine what your health will be like in 5 or 10 years. So don't try to change everything at once. Pick at least 2 or 3 tips from today's video and start using them today. Add another one in a week. That's how you get results that last for a long time. And if you found this video helpful, give it a like and share it with your loved ones. Thank you for watching until the end, and stay healthy.